In this video, I would like to talk about low vitamin D or vitamin D deficiency. And vitamin D is a vitamin that is made through the sun by the sun. It hits your skin and your body converts it into this hormone that we call vitamin D. And the vitamin D allows you to absorb calcium and allows it to put it to build your bone. The other thing that it does is that it improves your immunity, and it also improves your balance. And even we find that there's so many things that low vitamin D can cause, and or vitamin D is involved, that we don't know all of it, but even depression can be caused by low vitamin D. So the way we check vitamin D is by ordering vitamin D levels, but you have to be careful because you have to have a good reason to order vitamin D that is approved by the insurance. Otherwise, it could be $300 the bill they get. So what are the reasons? And what we do is we're gonna use the vitamin D deficiency subjective template that we have, and basically we're asked about, somebody has sun sensitivity. These people would avoid sun exposure, which would lead to low vitamin D. But whenever somebody tells you about sun sensitivity, think about lupus. Sometimes that's the one symptom or one of the symptoms that will lead you to start checking for lupus, and it's that the patient gets a rash when they're exposed to the sun, or they just feel very bad when they're exposed to the sun, and therefore they avoid the sun. But some of the reasons that allow you to order vitamin D is osteopenia, osteoporosis in their history, hypo or hypercalcemia. That also would be another reason that gives you the ability to order vitamin D. But just be careful when you're going to order it. But you also ask about imbalance, because when the vitamin D is low, people can have imbalance. You can ask about bone pain, because as calcium is being taken out from the bones expands, and that causes pain. And fatigue and tiredness also can occur when somebody has low vitamin D. And I'll give you an example of a story that happened with a patient that it was the first time I saw her, and she could hardly walk. She felt very tired and pain all over the body, and I checked everything, and the only thing that came back abnormal was vitamin D. So now, how do we treat vitamin D? Basically, the treatment is, and here I'm going to type that LR vitamin D assessment and plan. But the treatment is basically Drisdol, which comes in a capsule and is 50,000 international units every week for 12 weeks or 3 months. And after that, they can start vitamin D, 2,000 international units every day. And then you just keep an eye on it. You keep on checking every 3 months or every 6 months. As long as the levels are good, then you could wait longer, but you give it along with calcium and magnesium. One thing I gotta tell you is that before giving Drisdol, you want to make sure that there's no hypercalcemia, because if there is a lot of calcium, then that would lead to hypercalcemia increase, and that can lead to a lot of problems like bone, just kidney stones. And if you look at what hypercalcemia can cause, it's so many bad things that can go there. So just make sure that you do not give vitamin D in the if there is hypercalcemia present.